So just to sort of kick off, so what are ULHT? And when I say ULHT, I mean United Lincolnshire Hospital Trust. So what are your key priorities for the next 12 months?
We have 5 priorities, so I'll run through those. The first one, and obviously the most important, is quality of our care. And we have a number of specific projects that we are taking forward on quality. A lot of this is tied up with our work with the CQC around our special measure status. And this is sort of things that patients would see in terms of the quality of care they get from their nursing team or their medical team. The second one is fire safety. When I joined the trust 2 years ago, I was horrified to see that we weren't complying with fire safety regulations. So we've decided that is completely unacceptable. So we're investing around £2.5 million a month, improving the quality of our fire safety work. Patients are safe now, but we know we can get a lot further. That's number 2. Number 3 is our urgent care pathways. So people will know they're coming to A&E. If they're seriously ill, they get admitted into the hospital, and then as an urgent care patient, they get looked after. We do relatively well, but we can do far better, we believe, around how fast we see people in our A&E departments and how well we can look after them, maybe not in hospital, but maybe transfer them back into community care. That's the third one. The fourth one is around cancer services. We know it's a big issue for us as an organisation and the country, and every time anyone uses the C word, immediately there's panic and so on. And the first thing they want to say to us, they want to be seen promptly. Our cancer pathways have improved, but we still struggle to deal with people in terms of that diagnostic stage. Probably the better news is they get treated, particularly for things like breast cancer, within reasonable timeframes. So that's the fourth one. And the last one, and probably the most trickiest, is around the money. Our financial position, I think everyone realised that the NHS is under a lot of pressure to balance its books. So we have struggled with that for a decade or two, I think, as an organisation. Our deficit is growing, so that's a big issue for us and our regulators. So we have to make sure that those first 4 aren't knocked off course. I need to redress that. So they're the 5 that hopefully our staff would recognise.
And sort of more specifically, is there anything that you're working on at the moment to try and improve those that you can sort of delve into a little bit?
Well, a lot of this comes back to the workforce, because we're heavily dependent upon temporary workers. We spend £2 to £3 million a month on temporary workers, and that's because there's a national issue with workforce, but there is also a particular Lincolnshire issue, and we've been dealing with that for a number of years. So what we're trying to do is we're trying to keep the staff we've got, and our retention rates are very good. We're trying to attract more people in, so we were recently at a big national careers fair recently with lots of our staff there, trying to attract people into Lincolnshire, and that's working. So we had 82 new nurses started with us over the last couple of months. We're still getting people from outside the UK, and we're encouraging people to come into the hospital, whatever their clinical background. We had a new A&E consultant join us recently, great news, at Lincoln County. We also need to think about, can we redesign our workforce models and come up with different ways of working? So if you want to become a nurse these days, you can join our new cadet scheme, which is for local people coming into the junior levels of nursing. You can go into a nursing apprenticeship, you can go through a degree nurse, and then you can also be a nursing associate, which is a sub-level of nurse. So there's different ways of coming into the hospital to really suit some skills and experience, and we embrace them. So there's lots of examples of where we're trying to be really creative about approaches to recruit.
Oh, that's really good to hear. So sort of get them interested at an early stage, therefore they sort of follow their career within.
Absolutely. I come across lots of people who are registered nurses that started as a healthcare support worker, and we've supported them through that conversion, and of course they make fantastic nurses because they've seen it from every single angle. So I think workforce is a really big exciting one.
And there was some news in the media, I think only last week, about the sort of more you've recruited more GPs and into sort of A&E and that kind of.
We have. So what we've launched at Lincoln and Boston is what we call a primary care stream. We actually have had it in Grantham for a number of years, where we have GPs in the department. The reality is that there is a large percentage of patients who come to A&E that don't need to be seen by A&E specialist staff, and the number's probably up to to a third. So it's a third of patients coming into it, and
Big proportion.
it's a big proportion, and we've tried over many years to say we'd rather you go and be looked after elsewhere, but we are a service that has the lights on in 24 hours a day, 7 days a week, so people are turning up. So rather than try and push that tide away, we've embraced it, and from this week we'll have the services fully up and running. They've been running in the startup mode over the last 2 or 3 weeks, and we'll have from 8 a.m. till 11 p.m. Nurses and doctors who can deal with those lower level cases in our A&E departments. So if you come in, you may not be seen by a trained A&E doctor. You may be asked to join a primary
Sort of
care
like a
stream.
triage sort of service.
You get triaged, and then you get looked after, and then you'll go home or be looked after by your GP, maybe looked after by your outpatient service, but you won't come in as a hospital as an inpatient, and that's a way of dealing with far higher levels of volume we're dealing with at the moment.
So we talked obviously about your key priorities for the next 12 months, but looking sort of a bit closer into the future, how do you believe you will cope with sort of winter pressures? And is there anything you're doing to sort of preempt some of that?
We are, because obviously lots of stuff around flu, for example, and the experience in Australia and how the impact that will have potentially on the UK. So we are ready, and we've been working on this thing. Normally, as soon as winter finishes, we have a day off and we plan for next winter.
Right.
So, and winter preparations are not just for the trust; they're for all our colleagues and partners in health and social care. The examples you've given around GPs and what they're doing is very important to us. So, what we're hoping is that people, if they have been offered it, they will take up their flu vaccination. It's really important. The evidence is it works, and it has a huge impact. This, of course, for our staff. Of course, we don't want our staff to get flu as well as for our patients. So our staff last year, almost 3/4 took up a flu vaccination. So looking for the same sort of take up. We are strapped with our expansion of our beds, because we're running already at very high levels of occupancy. So what we intend to do in the past is open up more beds. We can't do that this year, mainly because we haven't got enough staff, haven't got enough space, and some of the fireworks we are doing to enable our fire improvements means we can't expand it. So we're improving our systems and making sure that where patients can be looked after, for example, in community services, either go direct to community services or through the hospital and be discharged promptly to those services. It's a way of making sure the demands are managed. So there's been lots of planning work and modelling work. We believe we can do it collectively, but I think it will depend on patients looking after their own health. A good example of this is we've had a norovirus outbreak in Lincoln over the last week or so. And that's been brought in. It's not something that's generated in the hospital. It's been brought in by people outside who come in, either a patient or as a carer. As a result of it, we've had to close a couple of wards to admissions. That's something the public can help us with. If they have symptoms of diarrhoea and vomiting, don't come to hospital.
So you'd advise patients, if they have got those symptoms,
if you've got diarrhoea and vomiting, you don't need to come to hospital. You can look after yourself by keeping warm, taking fluids, looking after yourself, but by coming in and then spreading it, then absolutely. And people in hospital, for a reason they're sick, they don't really need additional distress.
Could you give us an update on the temporary closure at Grantham A&E? Update on that.
So people remember that August in 2016, we took a very difficult decision to, at that point, temporarily close the hours from 6:30 p.m. till 8 a.m. We are reviewing that at our board next week. So we are, as we speak, producing a paper on what the hours should be going forward. We have always said that if we reach a certain threshold with our middle grade medical staff, then we will open. At the moment, and that threshold is based on 21 middle grades. And the reason why that's important to us is because we went as low as below 12, which is why we had to close the service back last August. But actually the establishment is 28, so even at 21, so it's still 3/4 of what we need. Now at the moment we have 15 of those 21 that are permanently employed with us, so not the 21. But we have temporary workers that take us over that threshold. So what we need to do is assure ourselves that if we are able to keep those temporary staff and substantive staff, of course, for a longer period, not just today, next week, or next month, but for a longer period, then we will safely. That has to be sustainable. So that we need to reassure ourselves that we can, for example, keep those staff on till the end of winter, till after Easter as early as the end of March, until into April. If we can do that, then we'll absolutely open. As I speak today, on Monday the 5th of October, I don't know if I can do that. By the end of this week, before the board meeting, we'll know the answers to that. It's a big issue for the public of Grantham. We understand it's sensitive, but the last thing we want to do is to open it and then having to close it because staff have left. Because people look at us and say, "What are you doing?" We'll only open it if we can reasonably think we can sustain it. And of course, one of the other things we have to be aware of through our financial special measures is we are trying to reduce our expenditure. What we don't want to do is have any impact of those financial changes when we spend a lot of money on locum staff and then end up having to squeeze a balloon at one end, it pops out the other. So we need to be really open and transparent with our public around this, and we'll do that at our board meeting next week.
And obviously it needs to be open in a safe environment as well, so there's no point opening it with sort of not enough staff to run it effectively
absolutely.
and safely.
Yeah. And if we do decide to open it, of course it will take us some time to gear it up because we have to reignite all those systems we shut down and bring in people, have to be rostered and so on. So they will, if we do decide...
No, it's not an overnight
decision, yeah.
With that in mind, some of the concern from patients is that, are people of the Grantham, Sleaford and surrounding areas less safe than they were before the night closure of Grantham A&E?
Well, I think they are, and we've been tracking this regularly all the way through since August 16, and there's nothing that we've picked up ourselves or working with the partners that shows us unsafe. It's difficult. We know that for some patients it means additional travel elsewhere, and particularly for the patients who stay in overnight and they have to get back. I know that's sometimes can be distressing, and we apologise for that. But in terms of risk to patients, there's nothing we've picked up in terms of any incidents. It's worth reminding ourselves that up until August 16, if a patient had very serious conditions, had a road traffic accident or they needed specialist heart surgery or trauma, they wouldn't have been looked after by Grantham. And I know that's a controversial issue where people wanted those services in place, but they haven't been in place.
Because the specialist services are elsewhere in the council.
So there are national networks for trauma, so people will go for a really serious RTO, road traffic accident, will have gone to either Lincoln or to Nottingham if it's really serious. Anyway, we have a fantastic heart centre at Lincoln, so ambulance services would have gone straight to the heart service. So those services have been in place in the meantime. And obviously, we are tracking the patients who perhaps would have come in out of hours whilst it was closed. So we're not picking up from our partners any big issues. We know it's of concern to the public. We understand that. But at the moment, we can say the service has run relatively successfully in light of the closure since August 16.
What would you like to say to patients of Lincolnshire to reassure them about the health and care that they will receive in Lincolnshire's hospitals?
Well, we have fantastic staff, and I'm fortunate in my job because I get to talk to lots of clinical staff, and I'm humbled by what they do. They come in, they're absolutely focused on the needs of their patients. They're highly trained and supported, and we're making sure that they've got the tools and support they need to their job. We're fortunate that we get, depends on the day of the week or the month, about 25 on average more compliments for every single complaint. Okay. So 9 out of 10 of our patients say that they get good treatments. Now, not to say that we get it right every time. I think patients know that's not the case. And every time we have a problem, we will learn from that to make sure it doesn't happen again. But we get a lot of support from our patients. We get great treatment from our staff. So it's a huge opportunity to say thanks to our staff.
With that in mind, what are you most proud of with what the Trust has achieved through this difficult time?
I think it's the resilience of our staff. They are under a lot of pressure. So the volume of patients we're seeing in outpatients, the volume of A&E attendances, the volume of admissions are going up. So whilst we have recruited, it's not kept at quite the same pace as we want. We are under pressure. Obviously, the NHS isn't getting any more funding from the government. We understand the reasons why, So the fact that staff, a lot of them do long shifts, and you talk to them,
Yeah,
they
it
come
can't
up
be
with,
easy.
with a smile on their face. I was on a ward recently, and there was a fantastic atmosphere. They were coming to work because they wanted to be there. They were doing a good job. There was a smile on their face, and they cared about the patients. But they were incredibly busy. So I think that's the big message, isn't it? It's our staff that make it work so well.
What is a sustainability and transformation plan, what they call the STP, and what does this mean for hospital services in Lincolnshire?
Well, basically, the STP is a 5-year plan for the county. So all it is that it's the health services have come together, and they've said across GPs, across the commissioners, there's a number of bits of the NHS. It's quite a complicated structure. We collectively have put a plan together to say, how can we ensure that we have a financially affordable, safe and good service for patients within that budget for the next 5 years? All it is. And for me, the way I describe it, it's got 3 component parts. The first is the part that we can have working with the college and the local authority to ensure that patients look after themselves. We want a healthier population. So I think people know that the number of it's self-care. It's also ensuring that we have a growing tide of obesity in young children, which we know we'll be dealing with this for the next 5 or 6 decades. So it's about diet, it's about activity, it's about education, it's about general health, lifestyle, smoking and so on. It's good to see that smoking levels have nationally come down to 70%. So that's never been. So, and that's everyone's, in my view, responsibility, because if we can have the population that know what to do and look after their own health, then they will be happy themselves, we know that, but also they'll be less in need of quite expensive healthcare services. That's a big first plank. The second is, this makes sense in a rural county where we know geography is a challenge. If you haven't got a car, it's several buses to get to hospital and so on. Can we provide better support to patients, particularly those who need frequent care, those with chronic conditions, or they've got vulnerabilities for whatever reason? Can we ensure they can get better care closer to their own homes? At the moment, the default often is they come into the hospital. That's geographically quite challenging for lots of people. It's also quite expensive. If we could provide a much more streamlined health and social care team around their needs, and we can look after them, they won't default into the hospital. We'll be there if they need them, if they need us. But the idea is to have much better community-based care. And we call these things neighbourhood teams. And those neighbourhood teams are getting off the ground as we speak. And the third is that when they do come into hospital, we need to make sure that we've got specialist care that has the right skill set, so that when they come in, the people are trained to do what they have to do. And a good example, I'm sure lots of people have heard this before, is the Heart Centre. So 7 or 8 years ago, we decided, not me but my predecessors, to centralise heart services, which seems controversial. By centralising heart services at Lincoln, we've improved life expectancy, because even though it takes longer to go from A to B, when you get to B, which is Lincoln, the skills of the staff and having the right equipment available 24/7 means that people's life expectancy has improved. And we reckon we've saved hundreds of lives by doing that over the last few years. That centralised model isn't right for everything, but that approach is constantly what you have to look at to say, how do we ensure that trade-off between geographical travel and centralised services is right? So there are a load of things we need to do around that going forward. They're the 3 planks.
Yeah.
Public health, supporting people close to their own homes, and ensuring that when patients do come to hospital, they get the right skill set, and the right expertise, and the right environment. Absolutely. Well, we've got about 12,500 NHS staff in Lincolnshire. That's not including GPs and all the practice staff. So that's thousands of workforce. What we need to do is make sure that every one of those contacts with the patient and the carer counts. So if we can all collectively to help in the right way, support patients to do the right thing, make it easier for them to do the right thing, then we can actually have a healthier population. So part of it is information. So I think part of it is just sharing the consequences. I remember still to this day seeing a big glass tube with tar at the bottom. And this was how much tar was generated by a smoker who smoked 40 cigarettes a day for a year. and I must have been 12 or 13 at the time, and I can picture that as that.
And shock message.
And that's probably not appropriate now, but at my age, it was really helpful to make me think twice about smoking. So there is something that we can do collectively. I don't think I think the public know what to do. They my view, they're very sensible normally. I think we need to make it easy for people to make the right decisions around smoking, around drinking, around substance misuse, also making activity easier. So social prescribing is a really interesting example of where we can encourage people to maybe have alternative treatments, which is not necessarily going to see a doctor in an outpatient setting. It might be taking more exercise. It might be going to a social group. I mean, I've got an elderly mother, and one of the big issues for older people is loneliness. And actually, if you get too lonely, then you get ill. So one of the answers is actually go to day centres and activity groups for older people, and that way they're healthier mentally, they're healthier physically, they're more active, and those sorts of things prevent people constantly defaulting into the health service for the wrong reason. So there's lots of things I think we can do collectively.
Yeah. So what needs to happen to make the NHS system more sort of patient-focused, more centred around the patient?
Well, I think this is really interesting because I come across some marvellous clinicians, some doctors, nurses, therapists, scientists who are great. And they get trained in a certain way, and they get trained to make decisions. And one of the things that we're encouraging all those clinicians to do is, by all means, make those decisions, but listen to the patient first. Because we know, don't we, as patients, we've all been there where, particularly if you've got a child or maybe an elderly relative, your parents, you know that patient very well, and sometimes you see the frustration saying, I know my child, I know my mother, and this is what's wrong with them, and they sometimes get a black look from the clinicians. So we need to be supporting our clinicians to keep their professionalism and keep that ability to make judgments and decisions, but doing it in a way that engages the patient and listens really actively to the patients and what they're saying. If we can get that right, we can get the benefit of the patient's experience at the same time as their professional experience of the clinician, then it'll be better. So I think a lot of it is just about really, really listening well to what the patient had to say and then making their judgment.
What's the biggest challenge the NHS is facing today?
Well, a lot of stuff you hear in the news is about the fact that NHS is underfunded, and we know that the reason why we are where we are is because of the link to the economy. So I think we're all looking forward to the budget statement in a few weeks' time to see if the NHS is going to be funded anymore. And one of the reasons why that's important is because lots of NHS staff have not had a pay rise for 7 or 8 years. And if they do lift the pay cap, as it's called, for staff, but don't give us additional money, then that'll make basically us having to make more savings internally to pay for that. So it'd be great to include money for new staff, but we need the funding to go with it. So that's a really big question for us. But it comes back to the workforce issue. Ultimately, the biggest issue facing the NHS at the moment is the hundreds of thousands of staff, not just nurses, that we're short of. And it's about ensuring that we can find creative ways of doing our jobs. For example, I think there's a big role for technology. I think if you just think about the whole way that our patients work, I'm sure lots of our patients would say, why did I trek in to have a follow-up outpatient appointment and it wasn't worth me coming? I'm sure we've heard that lots of times. Yeah. Or can we do it by phone? Can we do it by Skype? Can we find a way of ensuring that the patient's risks are covered, but actually not see it on a face-to-face basis? So we can use technology, I think, in a different way, particularly in a rural county, that make a big difference. So I think that's where we want to go as a hospital. Can we still do our job, but make it really easy for patients to access? If we can use technology more, we can reduce our costs. But ultimately, I do think we need more NHS workers, fundamentally.
And I think this is the last question. And I think we've sort of touched on it already, but what can patients and residents of Lincolnshire do to help improve the current situation with the NHS?
Well, it's one of the stuff we talked about, which is about self-care and making sure you have your flu vaccination if you can. Think about if you do need to come into a hospital, or you think you do, you've looked at your alternatives of going to pharmacy, that are fantastic, or using 111 as opposed to defaulting to only departments. I think the other thing we can have is we can have honest conversations with our patients and our public about what went right as well as what went wrong. We can learn as much as more from what went right as we can from what went wrong, to give us feedback. And so I'm sure people have surveys to the cows come home. So if you do get the opportunity to fill out your phones and family test score, we do look at things really, really carefully. We see them all the time, and we do make change results. So give us the feedback, and we'll promise to, if we can, to make the changes where we can. So it's giving that open view. Use the services appropriately. I think turn up when you get an appointment. We still have lots of people who do not attend, and that's a missed slot, it's a missed opportunity. That makes the same for GPs as well as hospitals. So turn up if you have an appointment. If you can't, let us know, and but just give us feedback.
Yeah, thank you very much. Thank you.
Yeah, thanks a lot.
Thank you.